ਇੱਕ ਵਰਚੁਅਲ ਨਿਊਜ਼ ਕਾਨਫਰੰਸ ਵਿੱਚ ਕੈਨੇਡਾ ਦੇ ਡਿਪਟੀ ਚੀਫ ਪਬਲਿਕ ਹੈਲਥ ਅਫਸਰ ਡਾਕਟਰ ਨੇ ਮੌਂਕੀਪੌਕਸ ਦੇ ਕਈ ਮਾਮਲਿਆਂ ਦੇ ਉਭਰਣ ਲਈ ਕੈਨੇਡਾ ਦੇ ਜਵਾਬ ਬਾਰੇ ਇੱਕ ਅਪਡੇਟ ਪ੍ਰਦਾਨ ਕੀਤੀ ਹੈ। ਕੈਨੇਡਾ ਵਿੱਚ ਅੱਜ ਤੱਕ ਮੌਂਕੀਪੌਕਸ ਦੇ 26 ਮਾਮਲਿਆਂ ਦੀ ਪੁਸ਼ਟੀ ਹੋਣ ਦੇ ਨਾਲ ਡਾਕਟਰ ਨੰਜੂ ਨੇ ਸੰਕੇਤ ਦਿੱਤਾ ਹੈ ਕਿ ਸੰਘੀ ਅਤੇ ਸੂਬਾਈ ਸਿਹਤ ਅਧਿਕਾਰੀ ਟੀਕੇ ਅਤੇ ਇਲਾਜ ਦੇ ਪ੍ਰਸ਼ਾਸਨ ਲਈ ਇੱਕ ਨਿਸ਼ਾਨਾਤਮਕ ਪਹੁੰਚ ਅਪਣਾ ਰਹੇ ਹਨ।
May be concerning to people in Canada, especially since the COVID-19 pandemic is still with us. Our understanding of the virus is still evolving, but I want to emphasize that this is a global response. We are working closely with our international, provincial, and territorial partners to keep Canadians safe. Limited cases of monkeypox have been identified in other regions of the world in the past, but never before in Canada. However, we have excellent capacity across our country to quickly detect and guide our response to emerging health security issues. Our National Microbiology Lab, or NML, is world-renowned for its scientific excellence. Currently, the NML is completing whole genome sequencing on samples of monkeypox, which will help our experts understand the chains of transmission occurring in Canada. The NML is also working actively to facilitate and support laboratory testing capacity in jurisdictions across the country. The agency is engaging with experts to finalize and release public health guidance on case identification, contact tracing, and isolation guidelines, as well as an infection and prevention control guidelines for the healthcare system. As the investigation is ongoing, additional information is still needed to determine the degree of risk for people in Canada. More information will be available in the days and weeks to come. What we do know is that there are different modes of transmission. Spread usually occurs through close contact with an infected individual's bodily fluids, respiratory droplets, or sores, or through direct contact with shared objects. People can lower their risk of getting infected and spreading the virus by maintaining physical distance from people outside their home. As well, wearing masks, covering coughs and sneezes, and practicing frequent hand washing continues to be important, particularly when in public spaces. Canadians should be aware of the symptoms of monkeypox. Anyone who may come into contact with a case or who is feeling unwell or has symptoms, including skin rash, that may be due to monkeypox, should limit contact with others and report their symptoms to their healthcare provider. Common signs and symptoms include fever, headache, muscle aches, exhaustion, swollen lymph nodes, and development of a new rash. The incubation period for monkeypox is normally 6 to 13 days, but can be as long as 21 days. While the risk of infection is currently low for the general population, monkeypox can affect anyone who is in close contact with an infected person or their contaminated objects. Contrary to some recent media reports, this virus does not discriminate and is not limited to spread from intimate sexual activities. This kind of misinformation and stigmatization can lead to misunderstanding of risks and negative health outcomes. We ask that all healthcare providers in Canada be extra vigilant and closely watch for patients with any symptoms of monkeypox,